The treatment for peripheral arterial disease is twofold. Okay, one, I mentioned that these patients are at higher risk for having a heart attack, having a stroke, so we want to be very aggressive in controlling their risk factors. Okay, keeping their cholesterol down, keeping their blood pressure down, keeping their diabetes under control. And the second area is that patients who have, when we mentioned claudication, having a discomfort in their legs, and when it progresses to a point where it's affecting the quality of life, that's when we would try to intervene. The first thing we do is we encourage them to exercise. Actually, exercise itself can improve the patient's ability to walk further. So we want them to try to walk, when they get the pain, they take a little break and they can walk further. And then we introduce some medications that can improve walking distance. Okay, it's called silastazol is one common medication that we use. And when patients still have symptoms despite exercise and pharmacological therapy, then we can do a procedure where we open up the blockage and we restore blood flow, and that reduces that can alleviate their symptoms. And it's often described as a life-changing event, because these patients often go undiagnosed for quite a bit of time. They have this pain, they cannot walk, they cannot it's really affecting their quality of life. And then by doing a procedure, and the first approach is a minimally invasive procedure. It's done in the catheterization lab. It's called the endovascular procedure, where we would just put a little tube that goes in the artery, the femoral artery in the groin, and through that tube we're able to open up the blockages and improve the patient's symptoms. And again, as I mentioned before, we often close the artery, and these patients are up and walking 2 hours after the procedure. Often they go home the same day, and now they're able to walk and enjoy life as they did not for quite some time. And the other area that we intervene on is patients who have what we call critical limb ischemia, and that's when they have pain at rest, or where they have an ulcer that's non-healing. They have gangrene, and that the effort is to try to improve flow, to save to allow the medications to get down to the foot, to the area where they need to get, and to salvage the limb. So those are the two areas. One is to improve their claudication, to alleviate that, and the second area is for critical limb ischemia, to save their the foot, because patients are at risk for amputation in that setting. Thank you for choosing St. Peter's.